I started my practice 19 years ago, and for me, breast reconstruction has always been an area of focus. And all of our improvements in the field have come when general surgeons and plastic surgeons have really communicated to understand what each other needs. And it's evolved into a significantly better result than even 10 years ago. Well, in medicine, we like to pride ourselves on being scientific. And when we come to large meetings, we're looking for the published scientific evidence that a treatment that a certain doctor is advocating is superior to the old model. But in fact, biologic systems and the illnesses that we as humans have are so complex that it's very, very difficult to control all the variables. And so therefore it's difficult to scientifically say that one treatment is better. What I feel is we should realize that when we practice medicine, we use our clinical judgment, which is really our intuitions, or you could say our gut instincts. Now, as human beings, we are excellent at using our instincts to handle complex problems. And so what I would advocate is that we embrace our intuitions and network our intuitions through collaboration. And in that way, we could filter out poor judgment and allow good judgment to emerge to the top. And that might be a superior model for innovation compared to the traditional scientific IRB controlled studies. I believe private practice cosmetic surgeons could be a model for healthcare reform, because for 20 years now I've practiced patient-centered care. My cosmetic patients are at the very heart of everything we do in my practice, and they pay fee-for-service. So I've for 20 years been focused on value. What is the outcome divided by the cost? I'm interested in what big data and cloud communications can do for medicine. I'm so interested and dedicated to it that I formed a healthcare innovation social network called Reconstruction. And in 2012, early 2012, we launched that concept at the Baker Gordon Symposium in Miami. And that's an international meeting, and so as a result of that, we've had people join the network from 5 different continents. And over the last 2.5 years, we're trying to grow it from a prototype site to an actual functioning social network that could innovate and come up with solutions for healthcare. I gave up on acellular dermis matrices 3 years ago, and I've used TIGR matrices, and there's a few other competitors that are out that I've tried as well. But what I love about TIGR Mesh is that when I put it in, it feels like a dress shirt. In a month, it's as soft as a silk nightgown. And as a surgeon, to be able to use a fabric that's so responsive and forgiving as opposed to stiff, it's easier for me in the OR. The patients can't feel it. And I don't worry that the matrix will injure, say, a breast implant or tissue. You know, it's every surgeon's dream to be able to control the tissue. We know that some patients are very healthy. Their skin and muscle and fascia and collagen is very good, and we know we're going to get a good surgical result. Unfortunately, most patients aren't so fortunate, and so if we could control the tissues, if we could engineer the tissues to be more desirable, then we could control our outcomes across the board for everyone. So when I first heard that TIGR Matrix had come out, I immediately began using it, and I never went back to using the old materials again, because I loved the way it allowed me to control the tissue and add strength to otherwise unhealthy weak tissue.